Hi, I'm Aniston. So today I'm going to be talking about acute mountain sickness. So my team is a football team. We are traveling to Colorado for like a scrimmage. It's the summertime. It's 80 degrees. It's humid. Altitude is 5,500, so really high. To start, they are at practice. It's Wednesday. I did get there early before I started taping, just so that way I could use my heat stress index. I know I'm in higher altitude, but also it's really hot, and for football, it can be very dangerous if it's too hot and too humid to practice outside. I did check the altitude, so I did make some modifications since it's really high. I did do that for that, as well as for the heat. The index, if you don't know what that is, basically you get a green, an orange, a red, or like a purple red. Green, you're good to go. Orange is like warning, so you should probably modify practice a little bit. As well as for red, danger, definitely do modifications. And then for purple red, for me, I would honestly cancel practice, as well as maybe tell coach to move practice inside, because it is way too dangerous to practice outside, whether with pads or no pads. So I went out there before I started taping, and for the players got there, and I saw that my area was in the orange/red, more of the orange, but it was very close to danger. With the high altitude, I did tell coach no pads, just because I didn't want to risk anything, especially since it is really warm and it was close to danger. And with the high altitude, it was just best if we stayed no pads. I did tell coach that he needs to do water breaks more often, probably about every 15-20 minutes, just because of the high altitude and the heat. I don't want anyone getting sick, especially the acute mountain sickness. I want to avoid that, so I want to keep them hydrated, as well as not get them too hot. So I did tell him no pads. He was fine with that. I did go into the huddle, and I said to all the players and coaches, I said, if you ever feel nauseous, dizzy, have a headache, let me know right away. Any other symptoms like that, just because I want to get on top of those symptoms, just in case it is acute mountain sickness. I'd rather be safe than sorry, and I want to get them safe and treated to help prevent it from getting any worse. So as I walked around practice, I stayed and I walked around just to make sure. If anyone needed me, I also told players to tell their coaches, just in case I wasn't near the area, they can come find me. So as I walked around, a player came up to me and said that he was nauseous, dizzy, and also had a major headache. I did tell him to go get some water, as well as to go into a cooler area. Some of them had pants on. Thank goodness he had shorts on, so we were good to go. I didn't have to have him go change into shorts or anything like that, so he was good to stay cool. But I had him go into a cool area for about a few minutes. He was in there for about 10 minutes. I had him come back out just because I stayed on the field, just in case anything else happened. He said that he came back and he said that he still was nauseous, as well as he became a little bit fuzzy and confused. And after he told me that, I immediately contacted EMS to get them to the field right away, as well as I placed my patient in the recovery position very gently, helped him down into that position, just in case they vomited or anything else went wrong where I had to perform emergency procedures. They're already down that recovery position and on the ground, so we were at a flat surface, just in case that happened before EMS had arrived. So with all of this, some things like takeaways about acute mountain sickness is, do not ever avoid your symptoms. This can be very life-threatening. If you do not treat it right away or you avoid those symptoms, it can get worse and it won't be better. As well as going in and you're going to a higher altitude, make sure you do check that and bring that in to modify practice. As well as if the altitude keeps rising, keep checking it throughout. When I was in there, I did check it throughout practice, and I kept looking at the heat stress index just to make sure I didn't have to modify it or stop practice at all. So always make sure you still have that on you, just to make sure if anything changes. It's very important to always keep monitoring that, just in case. As well as, like I said earlier, the biggest takeaway is do never avoid your symptoms. It is very important to trust your gut and your instinct, because you never know, and you would rather be safe than sorry. But some, I guess, references I used and websites was the National Athletic Training Association website, as well as the Cleveland Clinic website about altitude sickness. And that's my video.